Hi, this is Dr. Castanet. Today I'll show you a lumbar MRI scan of a 96-year-old woman. She's got a very interesting personal history. But anyway, with respect to her low back spine, she came to me with low back pain. Her daughter brought her to me, of course, and has right lower extremity pain. It radiates from the low back. This is a sagittal image, obviously, T2 weighted. Her spine looks pretty good for 96 years old, I would say. You'll see this is the biggest lesion of note. This is a compression fracture of L1. The superior end plate is compressed, and there's a invagination of disc tissue in here, what they call the Schmorl's node. But it's a intravertebral disc herniation into the body of the vertebra. This could be a source of pain, but it's chronic, according to the radiologist. You can tell that from how it highlights and the signal of this vertebral body. But otherwise, you see what you would expect to see in a 96-year-old spine: multi-level disc collapse, small herniations, not particularly consequential. There are a lot of potential reasons for her to have pain. It's hard to, I wouldn't ascribe all of her pain to this. This might not even be relevant particularly, but they're contemplating, the surgeon is a kyphoplasty or placement of cement in this to repair it. My sense is when he sees her, he may decide against it. It's probably not worth the risk of infection or any other complications in somebody that has other reasons to be miserable in the spine anyway. But we'll see what he says. I've treated her 3 times, I think, and she did get some benefit. So she might continue with that if she gets enough benefit, and if they decide against this procedure. We'll see. Of course, I'm really cautious with her, but now that I have imaging, I could be a little more aggressive in terms of decompressing her spine non-surgically, which is what I've done on 3 occasions so far with some benefit. Sometimes just modest decompression and modest help of something like this will help them significantly with their quality of life. So I don't like to deny it to them unless there's some contraindications, and since I didn't have any imaging, well, I had x-rays, but it looks to me like her bones are healthy. I don't have any bone density study, so I don't know what her T-score is, and I don't know that she had that done. I think I asked about that, and she hadn't had that done. So I'll continue to proceed cautiously if I treat her, but I'll be progressively a little more aggressive to see if I can help her some more, unless, of course, she gets the procedure and it helps significantly, which would be wonderful, but I don't think they're going to advise it in her, given the chronicity of this and the unlikelihood that this is the source of her pain right now. Her MRI report did report some severe neuroforaminal narrowing on the right side at a couple of levels, but I don't think a neurosurgeon would recommend surgical treatment either. Putting her under anesthesia is risky, and I don't think there's much point in doing that for her. Anyway, if I can help you, let me know. 404-558-4015. I'm Dr. Castanet at backstrong.net in Decatur, Georgia. Thanks very much. Bye-bye.